Hello and welcome to Ms. Nickel and Ms. Ryder's ATI and testing strategies Adobe workshop here. And we're going to go over 50 mental health questions that we've comprised from the Saunders book to help you not only with mental health, but also some test taking strategies that maybe you could possibly use in any class. So what we're going to do is we're going to look at these questions, but we're going to look at them a little bit differently. And I want you to actually look at your answers first. And when we look at our answers first, we can always figure out at least deleting 50%. So we can always generally throw out at least 2 or 4 answers if it's multiple choice and get us down to a 50-50. And then from there, we pick our best answer of the two. And we're going to show you how to do that. So if we go to question number 1, and I look at my answers first, I am your friend. Our relationship is a therapeutic and helping one. I can't be your friend. I'm the nurse, and you're the client. You have plenty of friends. You don't need me to be your friend, too. So when I look at those 4 answers, which answer is different and which answers are alike? Number 1, 3, and 4 all talk about being your friend, whereas number 2 talks about relationship and it being therapeutic. Your answer is number 2 because it is the different answer. Okay, if things are similar, they're incorrect. If something is different, it is probably your answer. So we're going on to number 2, and with number 2, our answers are, when your doctor comes in, I will ask for a pass for the weekend. Number 2, when the physician arrives on the unit, I will let him or her know that you have a question. Number 3, I will call the doctor and find out if you can have a pass so that you can make your arrangements. Number 4, you can't have a pass for the weekend. You're not ready, and I'm sure that your doctor will say no. So when we look at number 4, when something is very negative or telling a patient they're wrong or incorrect or a threat, that answer is incorrect. So number 4 is automatically wrong. When we look at 1, 2, and 3, the difference is there. When number 1, the nurse is asking for the pass, and in number 3, the nurse is still asking for the pass. In both 1 and 3, very similar, the nurse is asking the doctor if you can have the pass. Whereas in number 2, the difference there is the nurse says that she will tell the doctor that you'd like to speak to them, or the client would like to speak to them. She's not asking for them, so that is the different answer. Moving on to number 3, we have in our answers there, we have facilitating behavioral change, promoting self-esteem in the client, establishing the parameters of the relationship, and promoting problem-solving skills in the client. Now with that, if we go back to our question, we only want to look at what key words. The rest of the question is noise. So our key words there are orientation phase. Okay, if we're thinking about the orientation phase of a nurse-client relationship, is there behavior change in the orientation phase? No, there is not. Would you promote self-esteem in the orientation phase? No, you would not. Would you establish the parameters of the relationship? Yes, you would. And the answer is number 3. Moving on to question number 4, we have the admission was made or mandated by court order. Number 2, the admission was made without the client's consent. Number 3, the client has the right to demand and obtain release from the hospital. And number 4, the client was committed by a group of designated mental health professionals. If you look at number 1, 2, and 4, they are all against the patient's will, or the patient has no right, okay, or that right was taken from them. When we go back to the question states, and your priority or your key word there is voluntary status. The patient was admitted under voluntary status. So if it was voluntary, 1, 2, and 4 are incorrect. They're also similar, so they're wrong. The only answer left is the client has the right to demand and obtain release from the hospital. Moving on to number 5. A nurse is collecting data. Going to the answers. The last few weeks. Number 2, I haven't had an appetite at all. Number 3, when the medication begins to work, you will begin to feel better. And number 4, think about everything that you've been through. It will take time for your appetite to improve. Number 3 and number 4 are both promises to the patient. They're opinions and promises. We cannot, they're similar because of those factors, but we cannot give a patient an opinion or promise. So those two are wrong. That leaves us with number 1, the last few weeks, or number 2, you haven't had an appetite at all. And if we're talking about therapeutic communication, which one is more open-ended? And that is number 2, and the better answer is number 2. Moving on to number 6. Our answers are the client is calm and quiet. Number 2, the client is blaming her sister for the incident. Number 3, the client is justifying unacceptable self-behaviors. And number 4, the client is verbalizing generalizations about the incident. We go back to our question. Our key word there is denial. If a patient is in denial, would they possibly be calm and quiet? Yes, possibly. Would they be blaming someone else if they were in denial? Probably not. Maybe not the best answer, but we'll leave that one. Number 3, justifying unacceptable self-behaviors. Or 4, the client is verbalizing generalization. The best answer there is number 1, the patient is calm and quiet. It's also the difference. Going on to number 7, inform the client that the behavior is unacceptable. That's a negative. We don't generally have a negative or an attitude or disapproving or any kind of threat to a patient, so that one is probably not correct. Number 2, tell the client to wait in his or her room until report is over. Number 3, offer to assist the client to an exam room until the physician is notified. And number 4, tell the client that the physician will be called as soon as the report is over. So number 2 and number 4, I think you can see the similarities there. We said number 1 was incorrect. That leaves us with only the answer number 3. Moving on to number 8. Our answers for number 8 are use open-ended questions and silence. That sounds like therapeutic communication. Number 2, focus on the components of adequate nutrition. Number 3, focus on the fact that the client's beliefs are untrue. That's a negative. We know that's wrong. Number 4, instruct the client about the need for adequate nutrition. So 2 and 4 are very similar and basically say the same thing. So those are incorrect. And we already said that 3 was incorrect. That leaves us with only one possible answer, which is number 1. Moving on to number 9. Ignore the behavior. That's never a good idea. We can work that out. Number 2, tell the client that the meetings will be terminated. That's a threat. As I said prior, we don't threaten patients. Number 3, ask the client if something is going on that the client may have difficulty handling. That's a possibility. Or number 4, because the client is consistently late, begin to arrive 15 minutes later than the scheduled time also. And that does not sound like a good idea at all. So that leaves us with number 3. And the correct answer would be number 3. Moving on to number 10. Skip to our answers. Our answers are an indication of need for antidepressants. Okay. We are nurses. We are not doctors. We are not psychiatrists. We don't prescribe medication. So the indication for a need for antidepressants is probably incorrect. We don't prescribe. Number 2, an inability of client to terminate from the nurse. Possibly. Number 3, a normal behavior that can occur during termination. Possibly. Number 4, an indication of need for additional therapy sessions. Again, that would be determined by the doctor or the psychiatrist or the physician. So 1 and 4 are wrong. And that leaves us with the inability of the client to terminate, or is it a normal behavior? We go back to the question and look for our key word. And it says that the nurse is meeting with a client with a diagnosis of PTSD, is in the termination phase of the nurse-client relationship. The nurse notes the client has been quiet and withdrawn and interprets the client's behavior as. So if we're in the termination phase and someone is just a little quiet and withdrawn, does that show that they're unable to terminate? Or can that be a normal behavior? And whenever a relationship is ending, that can be a normal behavior. So the answer is number 3. But again, we had it down to 50-50 before we ever read the question. Going on to number 11, we have Milu therapy, aversion therapy, systematic desensitization, and cognitive therapy. And if we think about the meanings of this, Milu therapy is basically, in my mind, safety town, or we put a patient in a bubble. I think of drug rehab. When someone is in drug rehab, they're in a safe environment. Um, they are with their peers, they're with people like them, and generally they do very, very well. They don't use drugs. They may be in a 6-week or 12-week program, and then what happens is you take them out of that bubble, and then sometimes they relapse once they get out of that safe town. But it's basically like you're with your peers. Aversion therapy, I think of when someone touches a hot stove and they burn their hand, they don't touch the hot stove again. Okay, so you have a negative consequence. Systematic desensitization, I think of um, someone who's afraid of spiders. If we have someone who's terrified of spiders and we put them in a nice safe environment and we put them with a plastic spider and they get used to it and then maybe we get a small spider and a bigger spider and a bigger spider and slowly over time they become unafraid of spiders because of that safe environment and that desensitization. Cognitive therapy or cognitive behavioral therapy is always all of your talk therapy, so that's your group therapy. Um, it could be one-on-one therapy, but it has to do with physically talking it out and maybe a psychologist or some type of therapy. It could be your 12-step programs in some ways too. Okay, so the question here is our keywords are this is a drug abusers residential treatment center. So if it's a drug abusers residential treatment center, what therapy is it? And that's going to be NILU therapy. Going on to number 12. The client will talk to himself or herself to control actions more effectively. Sounds like a reasonable answer. The client will take medication daily to control the condition. Sounds like a reasonable answer. The client will be introduced to short periods of exposure to the phobic object while in a relaxed state. We already said just in the last question that that would be what kind of therapy? That would be systematic desensitization, right? Number 4, the client will meet with others with the same problem in a support group that focuses on the client's phobia. If they're in a support group and in that safety town, that's going to be NILU therapy. So when we go back to the question, your keywords there are systematic desensitization, and so that's going to line up with answer number 3. Moving on to question number 13, we have tell the client it is not safe to leave. That's a bit of a threat or a negative answer. Number 2, encourage the client to stay and ask the client what she is feeling. That is an open-ended answer and therapeutic communication there. Number 3, tell the client that if she leaves, she cannot return to the therapy group. That is a threat. Number 4, lock the door so the client cannot leave. We would never do that. So if we already ruled out 1, 3, and 4, number 2 is the only reasonable answer. Number 2 is your answer. Moving on to number 14, we have tell the client that he must leave immediately. Okay. Number 2, call the security to come to the session immediately. Number 3, tell the client that he can talk about his anger but cannot act on it during the group session. And number 4, tell the client that if he hits another, he'll be restrained and placed in seclusion. So number 4 is definitely a threat, so we're going to get rid of that. Number 1 is similar to a threat or a negative, so we're going to get rid of number 1 because you're telling them they must leave immediately. Out of our other 2 answers, what is the better answer? Call security to come to the session, or tell the client he can talk about anger but cannot act on it during the group session. And 3 is your best answer there. Moving on to number 15, we got avoid providing rewards to the client, promote complete independence in the client, reward the client when a desired behavior is performed, and provide consistent negative reinforcement to promote appropriate behaviors. Now, before we talked about if 2 answers are the same, we throw them out and that they won't be the correct answer. But I also want you to look at this question closely because if 2 answers are direct opposites, then it is one of those answers. And here's a question that has that. If we look at those answers, number 1 is to give a reward, while number 1 is avoid giving a reward, while number 3 is to give a reward. So if those are direct opposite, it is one of those 2. So we narrowed it down between 1 and 3. We go back up to our question and we look for our keywords. And our keywords there are someone with autistic disorder. So if we have someone that's autistic, would we want to give them a reward or avoid giving them a reward? And with the autistic patient, we want to give them a reward. So that would be number 3. Okay, number 16. Milu therapy provides a cognitive approach to changing behavior. What did we say cognitive was? Um, Cognitive therapy was talkie-talkie therapy, whereas Milu therapy was not talkie-talkie therapy. That was the safety count little bubble, right? Amongst your peers. Number two, a living, learning, or working environment is the focus of Milu therapy. Well, that is correct. Number three, Milu therapy provides a behavior modification approach to a type of therapy. No, it was not a behavior modification. Uh, and number four, a behavioral approach to changing behavior is a focus of Milu therapy. And that sentence is not even good. A behavioral approach to changing behavior. And again, Milu therapy was the safety town. The correct answer there is number two. Number 17. It is very, very hard to get over these types of feelings after being raped. That's more of an opinion from a nurse, so I would shy away from that one. What do you think you should do to reduce the likelihood that you will be raped again? That's blaming the patient, that she did something wrong to get raped. So I would take that as a false answer. Number three, tell me more about what happened and what causes you to feel like the rape just occurred. That is an open-ended therapeutic response. Number four, it's hard, but try to keep a sense of perspective. After all, it's been a while since this occurred. Again, that is not a therapeutic response. It is more of opinion, and we can't promise anyone anything. So number three would be your correct answer there. Moving on to number 18, place the client in a private room. Number two, establish a therapeutic relationship. Three, assign a leadership task to the client. And four, maintain a distance of 10 inches. Well, 10 inches is never appropriate. That's right in someone's face. That's in the personal space. And 4 is automatically wrong. And if we look at 1, 2, and 3, would you rather put a patient in a private room, establish a therapeutic relationship, or assign a leadership task? If we go back to our question, the key word there is suicide. High risk of suicide. What would you do for your highest risk of suicide? And that would be establish a therapeutic relationship. You wouldn't put them in a private room and you wouldn't give them a leadership task. Going on to 19, you are certainly entitled to your own opinion. Okay, that's a nurse with a little bit of an attitude. I know just how you feel. I have those days myself once in a while. Not therapeutic communication. Number 3, I disagree with you. Again, that's already negative. We already see that as negative. Number 4, you seem discouraged. Can you think of anything recently that went as you planned? So which one is the open-ended therapeutic communication? And that would be number 4. Number 20, looking at the answers, we have grandiose delusions of being a Caesar of Russia, constant physical activity and poor oral intake. Number 3, constant incessant talking with sexual innuendos. And number 4, outlandish behaviors and wearing odd eccentric clothing. Well, number 1 and number 4 are very similar. I would throw those out. And that gives us constant physical activity and poor oral intake, so they're not eating and drinking and they're constantly moving. Or talking a lot and sexual innuendos. What would be higher priority there? Number 2. Number 2 would be your higher priority.
And think Maslow on this one.
Absolutely. Think your Maslow's hierarchy. Which one is your highest on that pyramid?
Right.
Number 21. Answer 1. I don't believe that what you're telling me is true. So you're telling the person they're a liar. That's not a good idea. Let's get rid of that one. Number 2. There are no religious cults in the area that are going to kill you. So again, there you're telling patients that they're wrong. Not a good answer. Throw that one out. Number 3. What makes you think that cult members are being sent to hurt you? Now, that could be thought of as an open-ended question, so we're going to leave that as a maybe. Let's go to number 4. I don't know about a religious cult. Are you afraid that people are trying to hurt you? So out of 3 and out of 4, what is your most complete and your best therapeutic communication answer? And that's going to be number 4. And number 4 has a element of safety to it because it's, I don't know of any religious cults, but then it's asking an open-ended question as well. So it is a better answer than 3. Going on to number 22, and our answers here. Remain with the client. That's your one-on-one, right? Number 2, encouraging the client to talk about her feelings. Number 3, teach the client deep breathing techniques. And number 4, putting the client in a quiet room away from others. And if we go back to our question, we're going to pick our key words. And our key words here are we have um, someone who has just been assaulted. We have an assault and battery. And what would be your highest priority nursing action? So, would you remain with the client, so you're one-on-one? Would you encourage her to talk? Would you teach the deep breathing techniques, or put them in a quiet room away from others? So number 4 is going to be wrong. You're not going to leave them alone. Out of 1, 2, and 3, what is your highest priority? And that one-on-one is your highest priority. Okay, now we're going to go to question 23. And with 23, we're going to look at these very closely. And remember that whole if something is different, if something is opposite, it's probably that answer, right? So in the first answer, we have turn off the television and the radio and use the night light. So we're turning off the light. We're turning off the noise, right? Number 2, keep soft lighting and the television on during the night. So we have to keep the television on. Number 1 was turn the television off. Number 2 is turn the television on or keep it on. Number 3, change the client's room to one near the nurse's station. So when we're talking about light noise, when you go closer to the nursing station, it's generally louder and more bright, right? So we're keeping lights and noise on. Number 4, play soft instrumental music all night. Do not turn down the light. So number 2, 3, and 4 all have more light, more noise. Whereas number 1, we're turning off the noise, we're turning off the light. The answer is number 1. Number 24. Allow the client to set goals for a plan of care. Now this one's a little tricky because you might want to jump on that at first, but we don't let a client set their goals for plan of care. We do make sure that they're realistic and that the patient can agree to them, but we choose the nursing diagnosis as nurses and we set their goals from their nursing diagnosis. So that answer is going to be incorrect. We want to make sure that they're agreeable to the patient, but they do not set their own goals when they're under our care. And again, that needs to relate back to your nursing diagnosis, right? So that answer is going to be incorrect. Number 2, let the client act out initially. Should you ever let a client act out? No, you should not. So we know that that answer is going to be wrong. Let's move on to 3. Provide assistance with grooming and nutrition until the client seeking is cleared. That sounds like a reasonable thing to do. And number 4, repeatedly point out inconsistencies in the client's communication during initial treatment. Well, we do not do that. That's, again, a negative thing to do. So our only possible answer is going to be number 3. Okay, now we're at question 25. Answer number 1, I can hear the voices too, but they're telling you to go to bed now. We all know that's not a correct answer. We might want to do that, but we can't. Number 2, I know whose voices you are hearing, and I told them not to hurt you. That's very similar to number 1. We might want to say that, but we really can't. Certainly not a therapeutic thing to do. So we go on to number 3. I know you believe they're going to cause you harm, but it's not true. So there, with that one, you're saying it's not true. You're telling the patient that they're wrong, and that's a negative answer. So number 3 cannot be correct. I already am down to one answer left, and that's number 4, and it says, I don't hear them, but it must be frightening to hear voices that others can't hear. And that's the only one that could possibly be correct. Going on to number 26. Our answers are ineffective coping, chronic low self-esteem, risk for self-mutilation, and social isolation. Those are all nursing diagnoses, and they're all fairly good nursing diagnoses. But if we go back up to our question and look for our key words with this one, which one is priority? So what is your priority nursing diagnosis? And your priority nursing diagnosis would always be violence or self-harm, and so that would be number 3.
Again, Maslow.
Maslow. Good point, Miss.
Nice.
Okay. Going on to number 27. I think you need to speak directly to the psychiatrist. Number 2, maybe you'll feel better if you see the ECT room and speak to the staff. Number 3, your mother has decided to have this treatment. You should support her. And number 4, it sounds as though you're very concerned about the procedure. Let's discuss the procedure. Now, if you go back to the question, The key there is that we're talking to the patient's family and not the patient. So when we look at our answers, number 2, let's take you into the ECT room and talk to the staff. We might take a patient to do that, but we generally do not take patients' family members into an operating room or a treatment room or a procedure room. So that would be an incorrect answer, unless it was maybe a child, but we're not talking about a child here. And you're reading into that if you do. Okay? Number 3, your mother has decided to have this treatment. You should support her. That's telling the family member what to do, and that would be an inappropriate answer. So that leaves you with, I think you need to speak to the psychiatrist, or it sounds as though you're very concerned about the procedure. Let's discuss the procedure. What is the better answer there? The better answer of those two is number 4. Going on to number 28, we have the answers. Providing safety for the client and other clients on the unit. Number 2, offering the client a less stimulated area in which to calm down and gain control. Number 3, assisting in care for a client in a controlled environment such as a quiet room. And number 4, providing the client on the unit with a sense of comfort and safety by isolating the client. Okay. So if we're looking at this, number 2, 3, and 4 all talk about removing the patient, removing this person, and putting them in a quiet place by themselves. All 3 of those mention that. All 3 of those are similar. Therefore, all 3 of those are wrong. So the only one that is different is to provide safety for the client and other clients on the unit. And if we go back up to our question, what is the priority? And the priority is always safety, safety, safety. So number 1 is your answer. Number 29. Answer number 1. Ask direct questions and encourage talking. Number 2. Leave the client alone but check on her every 30 minutes. Number 3. Sit beside the client in silence with occasional open-ended questions. Number 4. Take the client to the day room with other clients for added supervision. Okay. Now, if we go back up to our question and we find our keywords are a patient is in a catatonic stupor and they're in a fetal position. Okay. If someone's in a catatonic stupor in a fetal position, you take them into the day room, plop them down in the middle of everybody? Probably not. So that would be an incorrect answer. Do you leave the client, number 2, do you leave the client alone? That would be an incorrect answer. So that leaves you with ask direct questions and encourage talking, or sit beside the client in silence with occasional open-ended questions. Would you rather ask direct questions or open-ended questions? The open-ended questions. So number 3 would be your therapeutic communication. Number 30, increase the number of hours slept at one time and is increasingly alert. Okay. Number 2, appears to be delirious but has stopped trying to pull out their NG tube. Number 3, tells the wife, I feel better, but the doctors want to give me a lethal injection. Number 4, keeps eyes fixed on the nurses while they are working in a room but has stable vital signs. And if we go back up to our question, the key word there is that the client's status is improving. Which of these statements shows the client's status is improving? We can throw out that they want to kill me and give me a lethal injection. That would not be improvement, right? So throw away 3. Number 2, the patient is delirious, appears to be delirious. Delirious is not going to show improvement, right? So we can get rid of 2. And then we have number 1 and number 4. Number 1 says that they're sleeping more and they're increasingly alert. Or number 4 says that they have stable vital signs. Which one is the better answer? They're increasingly alert and has more hours sleep. Okay, 31. Interrupt the client and offer to take her for a walk. Number 2, allow the client to complete her exercise program. Okay. Number 3, ignore the behavior. We don't ignore behaviors. Number 4, tell the client that she is not allowed to exercise vigorously. So, when we're looking at those, go back up to your 31 and look at your keywords there. And this is someone with anorexia nervosa. And what is the priority? So, do you want to interrupt the client or allow the interrupt the client and take her for the walk, or allow the client to complete her exercise program. If you look at those two, they're opposites, right? Interrupt or allow her to continue. Well, if it's someone with anorexia, we want to interrupt them and offer to take them for a walk. But again, those are two opposites, right? So it's one of your opposites. Going on to number 32. Here, again, we're going to find the answer that is different or opposite. Okay? In the first answer, we have hypotension, ataxia, muscular rigidity, and tactile hallucinations. Number 2, we have horse hand tremor, agitation, hallucinations, hypotension. Number 3, hypotension, stupor, agitation, headache, auditory hallucination. Number 4, fever, hypertension, change in level of consciousness, and hallucination. If you look closely, number 1, number 2, and number 3 all have hypotension. Number 4 is hypertension. Direct opposite is the one that's different. The answer is going to be number 4. Okay. We're going to go to question number 33. I'm sorry. This is not a good time to make that decision. Okay. What would your spouse think about your decision? That's not their communication. Number 3, what aspects of this situation are most difficult for you? Possibly. And number 4, you seem to have a good grip on the situation. You should probably get out. So number 2 and number 4 definitely not therapeutic communication. Out of what's left, 1 and 3, this is not a good time to make that decision. Again, you're telling the patient what to do or leading them on, versus what aspects of the situation are most difficult for you, which is an open-ended question. Number 3 is going to be your better answer. Okay, 34. Here's another one with symptoms, signs and symptoms. With this one, we have tachycardia, hypertension, fever, sweating, nausea, vomiting, and marked tremor. Number 2, increased appetite, irritability, anxiety, restlessness, anxiety again, and altered concentration. Okay. Number 3, we have depression, high drug craving, fatigue and altered sleep, hypertension, agitation, and paranoia. Number 4, we have increased pulse and blood pressure, low-grade fever, yawning, restlessness, anxiety, craving, diarrhea, and hydration. The things that I see that are different here, okay, they all have tachycardia. They all talk about hypertension. Okay, nausea and vomiting is a given with pretty much anything. But the things that I see that are different is number 1 has marked tremor, and number 4 has diarrhea and hydration. Those are what are different out of those 4 answers. So if we go back to our question, and this is someone with opioid withdrawal, would you expect someone with opioid withdrawal to have marked tremor, or would you expect them to see diarrhea and hydration? And if you don't know what hydration is, it has to do with how constricted or dilated the pupils are. Okay, so would you expect their pupils to be affected and them to have diarrhea, or would you expect them to have a marked tremor? Well, it's the opposite. It would be fine tremor, so that one's wrong. And that leaves you with diarrhea and hydration. The answer there is number 4. Going on to 35. Again, we talked about if answers are alike, then they are incorrect. So we have Zoloft, which is an SSRI. We have Valium, which is a benzodiazepine. We have Halidol, which is an antipsychotic, and we have Prozac, that is an SSRI. So we already just said that we have 2 SSRIs, so we can get rid of 1 and 4, and that leaves us with a 50 shot of Valium or Halidol. We'll go back up to our question. Keyword there is benzodiazepine, and it's diazepam is your answer, or the Valium. Okay, go to 36. And with 36, our answers are a client with pneumonia, a client who had back surgery, a client with a fractured pelvis, or a client who has had a myocardial infarction. And if we look at those, the client with back surgery is going to be an ortho patient. Fractured pelvis is going to be an ortho patient. Those 2 are the same. We can get rid of them. That leaves us with pneumonia, which is going to be an infectious patient, or MI, which is basically med-surg patient. So we go back to our question, and we find our keywords. And here we have someone who is in a state of starvation. And which roommate would you not put them with? Okay? What would be lack of understanding? So if you had somebody that is immunocompromised because of starvation, Would you not put them with an infectious patient, or would you not put them with a med-surg or an MI patient? We would not want to put them with someone infectious, so we would not put them with the client with pneumonia. Okay, number 37, we have call the nursing supervisor. Restrain the client and call a physician. That answer is incorrect because you cannot restrain a client before you call a physician. You have to have a physician's order in order to restrain the client. So it would have to be call the physician and then restrain the client. But it's backwards, so we know that one's wrong. We can't just restrain on our own, right? Okay, number 3, call security to block the exits to the nursing unit. We cannot block exits, right? So fire hazards, there's many, many reasons why that's wrong. So 2 and 3 are wrong. And then we have number 4, tell the client that readmission is not possible after leaving against medical advice. That's a threat. You're telling them they can't come back. So that tells me that 2, 3, and 4 are incorrect. And the only answer that could be correct there is call the nursing supervisor. 38, we have constipation, insomnia, hallucinations, staggering gait, slurred speech, and violent outbursts, nausea, vomiting, diarrhea, muscle aches, diaphoresis. Well, in number 1, we said constipation, and number 3, we said diarrhea. Those are direct opposites. Probably going to be one of those 2 answers. Let's look at 4 real quick. Decreased heart rate and blood pressure, dry nose, mouth, and skin. But again, back to our opposites, we got constipation or diarrhea. Okay? We go back up to our question. Our keywords there are heroin withdrawal. If someone was withdrawing from heroin, would you expect constipation or diarrhea? They would have diarrhea. So your answer there is number 3. Number 39. Exhibits impulsive behavior. Answer 2. Exhibits disorganized behavior. Answer 3. Has a history of suicide attempts. And number 4, has an immediate plan for a suicide attempt. We go back up to our question, and who is at highest risk, or the risk for self-harm, and who is at most risk. So who is at highest risk? Is it the patient that has an impulsive behavior, disorganized behavior, has a history of suicide, or has an immediate plan? It's going to be the immediate plan. So always remember those key words. Look for the priority, right? When we're talking about priority diagnosis, nursing interventions, collaborative interventions, remember that if we say nursing, you have to pick a nursing intervention or a nursing diagnosis. Therefore, you can't pick a medical diagnosis if the question is nursing diagnosis. So if it says nursing diagnosis, remember you're going to need that risk for injury, impaired mobility. You can't choose CHF. You can't choose fractured hip. That would be a medical diagnosis, right? And if we're talking nursing intervention, you must choose the nursing intervention. What are nursing interventions? Things like sit them up, do an assessment, take blood pressure. You cannot pick, give Lasix. Even though the whole entire paragraph describes a CHF patient, don't jump on that. If it says nursing intervention, you got to sit them up. You got to do a nursing intervention. You cannot give a drug. If it says collaborative intervention, don't choose the nursing diagnosis. If it says collaborative, these mean doctor's order. That's when you can pick what the doctor would do. Okay? If it says medical diagnosis, that is when you can pick the medical diagnosis. Okay? For instance, if we had a question that said, or describes a patient in CHF, and it says give the nursing intervention, again, sit them up. If it said give the medical or give the collaborative intervention, it might be give Lasix. If it was describing a patient and they say give the nursing diagnosis, maybe your top nursing diagnosis might be decreased cardiac output. Versus if it said collaborative diagnosis or medical diagnosis, you would choose CHF. So make sure that you realize that you're picking up on those keywords, collaborative and nursing, and intervention versus diagnosis. Okay. Move on to number 40. Answers here. What is causing you to become agitated? Why are you intent on upsetting other clients? That is not a positive thing or therapeutic communication. Number 2. Number 4. Please stop so I don't have to put you in seclusion. That's a threat. Not an appropriate answer. And number 4. You're going to be restrained if you do not change your behavior. Again, a threat. The only possible answer out of those is number 1. Move on to 41. And we have, you sound very unhappy. Are you thinking of harming yourself? Possibly. Number 2, those feelings will go away when your medication really takes effect. That's an opinion. It's also talking about a medication that we cannot prescribe. That would be an incorrect answer. Number 3, have you talked to anyone specifically about what is bothering you? Possibly. Number 4, I know what you mean. Everyone gets that way when they are depressed. That's an incorrect answer. So we got rid of 2, we got rid of 4, and we have 2 answers left that are possible. You sound very unhappy. Are you thinking of harming yourself? That is open-ended, correct? Versus, have you talked to anyone specifically about what is bothering you? Which one sounds like the better answer, which is more therapeutic? Number 1, because it also talks about how they're feeling, and then asks them a question. Okay. 42. I'm lucky to be married to a man who really loves me the way that he does. Number 2, I told him that this is his last chance. If it happens again, I'm leaving for good. Number 3, I stay because there's enough in it for me. I don't have to work full time this way. And number 4, things would be fine at home if I could just do better. He has a lot of pressures on him at work. And if we go back to our question, the key word there is that we're talking about a patient and she has low self-esteem. So what would show that she has low self-esteem? And if we look at our answers, number 4 is the only one in which she blames herself. So your answer is going to be number 4, because again she's blaming herself, and it's a different answer. 43, our answers are, that doesn't sound like the real you talking. That's a negative answer. You're telling the patient they're wrong, so that's not going to be right. Number 2, I'm sure you have someone if you think hard enough. Put words in their mouth, but we'll leave that one for a maybe. Number 3, it sounds as though you're feeling all alone right now. That could be definitely the answer. And number 4, I don't believe that. That right there tells you it's wrong. So we got rid of 1 and 4, and our answers are, it sounds as though you're feeling all alone right now. That would be restatement first, and number 2, I'm sure you have someone if you think hard enough. Out of those 2 answers, what's the better answer? The better answer is going to be number 3. Number 44, admitting the client to a room near the nurse's station. Answer 2, facing the client while speaking and providing nursing care. Number 3, arrange for a security officer to be available in the general area. And number 4, close the door to the client's room when giving care to the client. Okay, and if we go back up to our question, our key phrases there are risk for potentially harming others. And what would you avoid doing? So if this is a violent patient that could hurt you, would you close the door behind you? No, you would not. Because again, the question asks for what would you avoid doing. All the other 3 things, 1, 2, and 3, you might very well do. But 4 is something you would not do. And this is one of those questions that you have to make sure you read the avoid or don't do, right?
Yep.
Number 45, stay with the client at all times. So stay with the client, that's your one-on-one. Okay? That's generally a very, very good thing to do. That's usually a priority thing to do. Number 2, request that a friend of the client remain with the client at all times. That's putting our job off on someone else. That would be inappropriate. Number 3, have the client put on a hospital gown or remove the client's clothing from the room. Number 4, suggest placing the client in a seclusion room where all potentially dangerous articles have been removed. We go back up to our question. This is someone who has attempted suicide, and we want, what is your priority at this time? And when there is suicide, the priority is always stay with the patient one-on-one. Your answer is number 1. 6, we have continue to monitor the client's behavior from a distance. Number 2, document that the client is adapting to the unit and is feeling safe. Number 3, notify the staff of observations at the team meeting, which will begin in 3 hours. Number 4, speak to the client personally about the nurse's observations and ask if the client is thinking about suicide. Just looking at these, my priority would be to talk to the patient asking if they're thinking about suicide, but let's go back up to the question, look for our keywords, and this is a patient who has major depression. And what is the nurse's initial action? So if it's an initial action, would you wait 3 hours to talk about him at the staff meeting? No. Answer 3 would be wrong. Would your initial action be to document? Well, you'd have to observe before you could document. So that would be wrong. So that leaves you between 1 and 4. And would you continue to monitor from a distance, or would you specifically speak to them and ask if they're going to commit suicide? Your priority is going to be number 4. Number 47. I know now that I can't be all things to all people at all times. Number 2, it is important for me to take my medications just as prescribed. Again, we talked about if this is a nursing issue, then we're not going to talk about prescribed medications. Number 3, it's been good to learn better ways to deal with stresses in my life. That would be a good thing to do. Number 4, I know that I won't become depressed again after the treatment I received here. We go back up to the question, and the question, we look for our keywords. And our keyword here is that the patient could further benefit or further develop coping strategies. So what the question there is, that further word, or that further word is your keyword there. So we're saying that the patient is not coping, is not ready for discharge. What statements out of these 4 statements would show that the patient is not prepared, not ready? And there, I know that I can't be all things to all people at all times. That would be something that we hope the patient would know. Number 2, it is important for me to take my medications. We're hoping they're taking their medications. It is good for me to learn better ways to deal with stresses in my life. We would hope they would do that. Number 4, I know that I won't become depressed again. Is it true or realistic for patients to say they will never become depressed again? That is not dealing with reality or a true statement. So your answer there would be number 4. Going on to number 48. In number 48, we have take the client's vital signs, call a mental health crisis team, and notify that the client who attempted suicide is being admitted to the hospital. Number 3, perform a focus assessment paying particular attention to the client's neurological status. Number 4, assess the client's respiratory status for the presence of neck injury. We always think airway first in mental health. So I would go with number 4 before I even look at the question. But if I look at the question and I look at my keywords there, this is someone who attempted suicide by hanging. So if we looked at attempted suicide by hanging, would we look at their neurostatus first, or would we look at their breathing? We look to see if they're breathing. And we would certainly do that before we took their vital signs. That would be, the answer is number 4. That's your priority.
Assess is a keyword on that one too.
Right, assess.
Yeah.
So as far as called mental health crisis teams, that is not an assessment.
Right.
Right.
So I believe a lot of these, if there's assess, you want to hone in on that also, based on what it's saying that you're assessing. But that's a key word on that one as well.
Okay. Then we're going to go to, we're going to go down and we're going to go over a couple real quick of the select all that apply. And when you do a select all that apply, you need to remember that instead of just killing yourself at trying to figure out which ones are right, which ones are wrong, just treat each answer like its own individual true-false question. Okay? So, when we look at this question, an acutely depressed client is receiving cognitive behavior therapy. We said that cognitive behavior therapy was what? Talk therapy, right? So we talk it out. The nurse is developing a plan of care for the client and includes interventions that focus on this type of therapy. Which of the following interventions would the nurse include? So we're talking about cognitive behavioral therapy or talk therapy. Assist the client to identify and test negative cognition. That would be true or false. It's going to be true. Number 2, assisting the client to develop alternative thinking patterns. Would that be true or false? That's going to be true. Number 3, assisting the client to participate in the treatment process. That's going to be true. Number 4, assist the client to rehearse new cognitive and behavioral responses. That would be true. Going on to number 5, assist the client with administration of antidepressant medication. We said cognitive behavior therapy, which is talk therapy. not drug therapy. Therefore, 5 is going to be incorrect. Going on to number 5, assisting the client's family to participate in group therapy on a regular basis. Well, we said in our question that this is the nurse is developing a plan of care for the client, not the family. So we need to focus on the client. The answer here, true, false. Now we're just switch that focus to the family. Don't read into this. The answer is wrong. You just switch the focus. Okay. Going on to another select all that applies. Here we have a nurse is caring for the hospitalized client diagnosed with bulimia and nervosa. Would closely monitor which of the following. Now remember this says bulimia. It does not say anorexia and bulimia. It's bulimia. So bulimics do what? They binge and they purge, right? So, number 1, exercise patterns. This is not anorexia. It talks about bulimia. True, false? False. Number 2, would we want to closely monitor eye intake and output? Yes, we would. We want to know what goes in and what comes out, right? So that's going to be true. When we go to number 3, we talk about electrolyte levels. Would that be true or false? Well, that's going to be true because think about it. This patient is vomiting and purging. Then she is going to what? Be in metabolic alkalosis. And in metabolic alkalosis, what is the primary electrolyte that is affected? That would be potassium, and she's going to be hypovolemic. Okay? We really want to think about electrolyte levels. What's coming out with that vomit, right? Pupillary response. Is that true or false? That's going to be false. She didn't take drugs. It shouldn't really affect your pupils too much. Number 5, we've got deep tendon reflexes. Do not read into this question. Deep tendon reflexes is going to be false. It would happen maybe way, way, way down the line if a lot of electrolytes were truly out of bounds, but it would take a very long time and probably not be effective. Okay. Number 6, elimination patterns. Would that be? Yes, you definitely want to know that. That's along with INO, right? What comes out. So that leaves us with 2, 3, and 6 as true, and 1, 4, and 5 as false. All right. Thank you so much for joining us, Ms. Nichols.
Thank you. Hope that was very helpful.